The best answer to the question why musicians and organists are experiencing playing injury and how do we stop it is, it's complicated. Primary prevention is the #1 way to avoid injury, which means you can't get injured in the first place. Hi, my name is Sarah Svendsen, and welcome to the Organist Launchpad, a program brought to you by the Royal Canadian College of Organists. My research focuses on organist injury and prevention options. Like most musicians, I wear a lot of hats. I'm a performer, organist, teacher and choir director, arts administrator, church musician, and a researcher. My mission in my professional capacities is to provide and encourage questioning, inviting, and inclusive safe spaces for organists and musicians. I like to provide connection points, and I believe that music and organ is for everyone, and everyone with interest needs access. And the interest does not need to be specific to a genre of music or a system of learning. In 2020, a large survey went out to the membership of the Royal Canadian College of Organists, or RCCO. This was in partnership with the RCCO, Dr. Lynn Holness, and the support of the Center for Research Expertise in Occupational Disease. It was part of my doctoral work. It was lengthy and strategic, and it asked participants about the state of their playing pain, as well as about the larger physical and contextual information. It took about an hour to complete. It had a 20.6 response rate, and we were able to use the responses from 254 participants. The survey's purpose was to collect as much data as possible and to contribute to much needed information on organist playing pain and occupational health and safety. Understanding organist playing pain involves more than organists. It also involves all the players in the larger cultural context of the organist's day-to-day working life, as well as those who are used to help in treatment and prevention. Some of these players include medical practitioners, occupational health practitioners, universities and conservatories, churches, teachers and students, as well as the individual, the organists. Playing-related pain is pain which is experienced while playing one's instrument. It is a common symptom of overuse injuries. Overuse injuries are cumulative in nature and can develop slowly over medium to long periods of time. The most important takeaway we gained from the survey was that organists are definitely playing with pain. 90.6% reported some level of playing-related pain at some point during their career. Most participants reported the duration of pain to be long-term, more than a year. The quality of pain reported by most participants was mild to moderate, and they were able to play through this pain. So many were choosing to go to a massage therapist or a chiropractor because it allowed them to continue to play. The best answer to the question why musicians and organists are experiencing playing injury and how do we stop it is, it's complicated. Most definitively, we know primary prevention is the #1 way to avoid injury, which means you can't get injured in the first place, which means we need to know what causes injury. But that's not simple and not singular, because we already know that we have multiple issues that can contribute to overuse. Just like learning to play an instrument involves many systems being used together, many risk factors can interact with each other to influence experiencing pain while playing. So that's a very important note. Playing pain risks are cumulative and involve many factors. Many people take a common linear approach here. They assume that the event most easily corroborated with the appearance of pain is its cause. This can sometimes be the case, specifically something like a blunt trauma, like jamming your finger in a door. But in occupational situations where pain appears while doing one's job, it's likely that compounding factors are contributing to the situation, and that whatever was happening at the time of onset of pain was one of many other contributing factors. I'll be going into more detail in the next couple of videos, but there are some overarching concepts that are very useful to take away. 1, approach systemic issues of playing through injury with support and understanding rather than accusation. 2, encourage the value of self-care and safety. 3, encourage communication between organists and any supervisors. And 4, Work smarter, not harder. To learn more, you can check out courses for musicians with physical components, like body mapping. You can also check out the titles you see here. And you can click on my next video.